So this talk I gave an overview of the vascular wounds in terms of what's their outcome if we do nothing and how should we manage them. I talked about a team approach in their management in terms of utilizing other specialties, wound care, physical therapy, podiatry, plastic surgery, and also interventions through cardiology, interventional radiology, or vascular surgery. I didn't go specifics into the type of intervention. Also talked about the role of the timing of when we should do the debridement of the foot or amputations. Also talked about plastic surgeons, how they can be involved in tissue coverage. And finally, that we just needed to watch these patients and work together because they were very difficult. I think it's gaining popularity and it's showing that it makes a difference in terms of how we manage the patients and saving their limbs. But sometimes different things get in the way, ego, logistics, and sometimes even money can be all barriers to having a successful program for these patients. I think at our center, the biggest barrier was logistics in terms of space and ego, and we were able to overcome those by meeting together and trusting each other and moving forward together, and we had a successful program. I think the key is going to be making sure that we get to them early. The education in terms of letting them understand how they can prevent it, and also the education of the primary care physicians. Do we keep these patients in our care for a while, or do we send them back and hope that nothing else happens again? So I think those are going to be some of the keys in terms of how we manage these patients. Once they come to us, we're very good at utilizing all the resources of the different specialties to manage them, most of the time successful, obviously sometime unsuccessfully, but I think it's going to be the role of the other specialists like the primary care physicians, how are they going to be integrated with these patients for us, and also educating the patient.